Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
With all our modern medical knowledge, why is chronic disease still on the rise? What are we missing? Is there a hidden truth behind chronic disease? Mission Evolution Radio Show is coming to you around the world on the X-Zone Broadcast Network, xzbn.net. With us this hour to uncover the hidden truth behind chronic disease is Dr. Thomas J. Lewis. Dr. Lewis is a leading authority on the mechanisms of chronic disease. He holds a Ph.D. from MIT and credentials from the Harvard School of Public Health. His main function as a leader of Health Revival Partners is translating the best-of-breed medical knowledge from mentors and thought leaders into logical disease prevention and reversal medical protocols. Dr. Lewis is the author of numerous books, including Cancer is an Infectious Disease. His website, healthrevivalpartners.com. Dr. Lewis, thanks for joining us on Mission Evolution.
Gwilda, really a pleasure to be here.
It's so nice to have you. So tell us a little bit about your training.
That's a really good question. It could be a long story, but really, I was looking at Alzheimer's 30 years ago. And then my dad came down with a disease. He died at the age of 87. My mother took care of him till the last month of his life. And a year after his death, I met a very unusual Harvard clinician, Dr. Clement Tremp, an ophthalmologist. And the retina is an outcropping of the brain. And he showed me how he was reversing this disease 20 years ago. And his results, we recorded videos for just a couple of weeks, and the results were extraordinary. And so what I did is I spent the next 15 years with him and Dr. Killen McCulley, a pathologist at Harvard who's written more papers on disease mechanisms than anybody, and really went through and dissected what their research, their clinical approaches, their outcomes. And we published some of that work. A lot of it we didn't publish because, it's not randomized clinical trial type data. I wouldn't call it anecdotal when you've treated thousands of patients and received good results. So even though I'm not a medical doctor, I was trained for 15 years under two outlier medical doctors from Harvard Medical School.
Okay, so what we're going to be sharing today comes from that training and the tests that you and the doctors did together.
Absolutely. I mean, hopefully I've evolved as a scientist to look at things very scientifically. In my opinion, and medicine is a scientific discipline, and it's the only one that doesn't use really sound scientific processes. If you look at, air flight, integrated circuit chips, everything's become better, faster, cheaper. Medicine has gone just the opposite way. So the only conclusion you can draw is that science and the scientific method is not being used or applied in the practice of medicine today, and for the last if ever.
And you're speaking of this as a scientist.
I am speaking to this as an MIT and Harvard scientist. Yep.
Yeah, there we go. So,
Which can be good or bad, right? Depending on your
right,
perspective.
absolutely. So go a little bit more into that. What do you mean they're not using the scientific method?
Well, if you listen to some of the pundits, they talk about consensus. And then we have the tail wagging the dog, and that is big pharma and these large medical societies that work from consensus. And then the insurance companies really control what doctors can do with these ICD codes, ICD-10, now emerging ICD-11. And it really handcuffs doctors to use.
I'm sorry, back up just a little. What is ICT 10 and 11?
ICD-10 is the international code for diagnoses. I believe but this is the code book that every doctor that wants to get paid for what they do by the insurance companies must use.
Okay,
And
so in other words, if you're going to get paid by an insurance company, you have to look up the exact number that they've decided goes along with a diagnosis. If you have a diagnosis that doesn't go with any of those numbers, what do you do?
well, and even if you have a diagnosis that goes with that number, it doesn't mean it's a correct process. It's usually symptoms management. There are 68,000 diagnostic codes in ICD-10. I mean, it's impossible to keep track of that, but you have to log that in your EMR to get paid. And then the other big issue is not just are you controlled by the codes that the insurance companies will pay you from, and sometimes they're very hesitant and it takes a long time to get paid, but they're not really science based. And but what they do is they protect the doctor from malpractice liability, so the doctor then is in this very tight box where they won't stray outside. So for example, statin drugs, if I prescribe, or an MD prescribes a statin drug, and you walk out the door and have a heart attack, there's no malpractice liability. But if you didn't do that, even though it's the wrong therapy for heart disease, you put yourself at great risk of being marginalized by your society that calls this the consensus standard of what you should be doing, and potentially from the patient and their lawyer team to sue the doctors. So it's really been set up as this thing where doctors are afraid to do anything creative. So in some respects, medicine has become like law. It's a discipline of memorization rather than critical thinking now. And so because they just can't go outside the box. My son's an optometrist, and when Steve Kirsch had this, he's a very famous MIT guy, billionaire, that you know, figured out how to build the optical mouse. So he patented the optical mouse. Had a hemorrhage in his eye about a month or two ago, and I reached out to some of the top optometrists and ophthalmologists, and they recommend this treatment, eye injection, that increases mortality by 270% in 2 years
Oh my goodness, immortality of the patient?
of the patient. And that's not, I'm not making this up. This is actually in, for example, Lucentis is one of the major things that's injected in the eye. It's called anti-VEGF, and it's on their package insert. In the fine print at 6 point, so small you need a magnifying glass to read it, and no doctor's doing that, but it's the standard of care. So one of the top optometrists in the world said, "Yeah, you do these injections," and my son says, "Yeah, you do these injections, ha ha ha," knowing that, because he was trained by Dr. Trump, that this is a very bad thing to do. But guess what? It's the only option for someone like Mr. Kirsch, who at in his mid 60s, the world's his oyster, billionaire, and doing fantastic work. And suddenly he's in this traumatic state of literally going blind in an instant, and no one knows what to do about it. And he's working with ophthalmologists at Stanford and other, in the Silicon Valley area. And believe me, they have no idea what caused that that event to occur. But basically, they call it a hemorrhagic event of the retina. No, it's the retina is an outcropping of the brain. What Mr. Kirsch had was a stroke. And the sad part of this is that I talked to him for an hour, that he was being watched, monitored, but not treated for early macular degeneration. And they don't start treating until you have bleeding in the eye. And unfortunately for him, his bleeding was catastrophic. He didn't get any early warning, but this was something that could be completely prevented. But his ophthalmologists were following the standard of care perfectly. Dry AMD, watch it. Wet AMD, do the eye injections, and the outcomes are horrendous. Number one, it's a cardiovascular disease manifesting in the eye. Number two, the package insert from Lucentis, Genentech, now Roche, says the 2-year mortality increase for someone with these eye injections is 270%. So
So
this is
now if we distill this down, what we're looking at is the uh, standards are being dictated by the insurance company, not trained medical doctors.
that's correct. And then what you have on these committees, these large committees of doctors in the American Medical Association and other associations, get most of their funding from the pharmaceutical companies. There's really very little, few independent funding groups that with deep pockets. But some of them, like Gates and things like that, Wellcome Trust, are all in the pocket of the pharmaceutical companies anyway. So they are doing research to support the thesis of medical devices and pharmaceuticals. And there have been very few cures, if ever, in the last 20 years from the use of these drugs. It's a management process. A cured patient is a lost customer. So, I will tell you, I'll give you an example. So Steve Schmidt's a friend of mine. He's a medicinal scientist and he worked for Warner Lambert. And then Pfizer bought out Warner Lambert and he worked on Lipitor development, which is the largest selling pharmaceutical of all time. And when Dr. Tremp and myself challenged Steve about what Lipitor really did and why it has a meager but mild benefit in very high risk individuals, but actually is worse for people that are not high risk, is we challenged them on the mechanism of how the statin drug worked. And he looked at me deadpan and said, "Yeah, we know that." And see, the why statins work is they're antibiotics.
Okay.
And the pharmaceutical company knew it could never prescribe an antibiotic for life. So they made up this, red herring based on Ansel Keys about lowering lipids and fats. But really, it statin drugs have pleiotropic mechanisms, meaning multiple modes of action. And most people know that it downregulates the production of CoQ10, but it's also an antibiotic. And it's a very bad one. So, in fact, most of the times, the the, the the downside of statin drugs is far worse than the upside. And
Okay.
so,
And what all are the statin drugs being prescribed for?
quote unquote high cholesterol. Now, let's keep in mind that cholesterol is a red herring as well, because what they're measuring is what's called total cholesterol, which, when you look at it, there's no way to determine what the cholesterol level is. Total cholesterol is LDL, which is a lipoprotein, plus HDL, which is a lipoprotein, plus 20% of your triglycerides, which are sugars. And even though it's called total cholesterol, there's no measurement of cholesterol in that equation. Yet it's
Okay.
the most
It,
demonized
Dr.
substance.
Lewis, it looks like we're going to have to take a station break.
That's fine.
Dr. Lewis and I will return very shortly, so don't go away. This is Mission Evolution, www.missionevolution.org.
Slow down, you move too fast. You got to make the morning last. Just kicking down the cobblestones, looking for fun and feeling groovy.
What's the hidden truth behind chronic disease? With us this hour discussing chronic disease is Dr. Thomas J. Lewis. Dr. Lewis is the author of numerous books, including Cancer is an Infectious Disease. Dr. Lewis, we are looking at what is chronic disease. It looks like you're coming up with a little different way of looking at it. Would you mind going into that a little bit for me?
Well, yes, I think it's important to understand that there are four major pathways in our body: repair, immunity, detoxification, and energy. And we really only focus on energy. And really, when you look at chronic disease, it's a balance between deterioration, which we all have. I mean, you do exercise and your muscles, you break down cells and you rebuild them stronger, and the repair of that tissue. And that's really all chronic disease is. And at the base of it is or are micronutrients, which are key to detoxification and repair, rebuilding, and recovery of damaged tissue. And it's
So,
that
so
simple.
let me see if I got this right. You're telling me that chronic disease is more related to the body's ability to repair itself?
100%. We're not a piece of plastic which just turns the dust out in the sunshine. We have repair pathways. So it's really important to work on improving immunity so that we have less damage, but also improving repair pathways so the repair stays ahead of the damage. And of course, we can't deal with aging. That's just something, but you can have healthy longevity if you work on repair pathways.
So, if you're looking at the, modern day health situation, what is contributing to dysfunction in our ability to repair and maintain?
That's a perfect question. And I think everybody recognizes now, not everybody, but the key pundits recognize that the corporate food, the tobacco companies owning big food, the over farming of our land. And so really it is the processed food and even our food that we get at the grocery store that's been grown in Iowa, Nebraska, wherever, where these mechanized farming techniques, they're putting very few nutrients back in the soil. So our plants and then the animals that eat those plants are very deficient in micronutrients. And what micronutrients mainly mean are minerals, because we have we have enzymes that catalyze reactions, immune reactions, but repair reactions. And so if you're deficient in micronutrients, molybdenum, cobalt, selenium, a whole host of these things, then your repair pathway is significantly attenuated. And
Do,
that's
it,
the biggest problem.
do those deficiencies also interfere with our ability to think clearly?
Well, absolutely, because when you look at the body holistically, the brain is 10 times more metabolically active than the average of all the rest of the cells in our body. So when look at the brain, it's going 100 miles an hour, and you need to be much more aware and be much more maintenance oriented for your vehicle that's going 100 than the one that's going 20 miles an hour. So the brain is definitely everything that is deficient. There's an amplification of the adverse effects in the brain. And the eye is part of the brain. The eye is actually, the retina is the single most metabolically active tissue in the entire body, but the brain is right behind it.
Well, it's interesting. You've mentioned the eye several times now. Now, this is not related to iridology, but it certainly starts to make sense where iridology might get some of its information if this is a direct pathway.
Well, iridology is looking at things that are going wrong with the eye. I look at pathology and what people don't understand. So they're interrelated, but a
Yeah, I'm sorry.
cataract,
I'm sorry. I was talking about the kind where they look at the eye.
right?
This is kind of and they look at the patterns in the eye, and they have ways of telling what the patterns stand for as far as where your body's stressed.
Correct. We have meridians everywhere. The same thing can happen in the mouth, looking at meridians that are infected or inflamed that lead to breast cancer, things of that nature. But in general, though, things like macular disease, glaucoma, and cataract, people with that and when you compare them to people without that of the same age, the ones with the eye diseases die much younger. So it just
Oh my.
shows that this is an outward manifestation of a systemic disease. And the medical community, it brings up another good point. The medical community are broken into such tight silos that eye doctors look at restoring vision or helping maintain vision completely independent of the health of the individual onto which that eye is located, and often at cross purposes. So yeah, cataract is as deadly as breast cancer. If I have two 50-year-old women, one has cataract, one has breast cancer, their 6-year mortality is the same, around 11%.
Oh
And
my
no
goodness.
one's doing no one's doing cataract walks.
Now, what does the cataract relate to as far as illness in the body?
Right. It's mainly cardiovascular. These folks, and this is the age-related eye disease study, National Institute of Health published in 2000. No one's reading it, but they die of, like what Mr. Kirsch, he didn't die, but he stroke, cardiovascular disease, things like that, because That opacity, we call it cataract, is actually part of the innate immunity that fights infection. And we can see it in the eye because the eye is transparent. You can't see it in the heart or other vessels, vessels of the brain where you can have a stroke. But usually, if they're in the eye, they're elsewhere. And that's why these eye diseases portend such high mortality or bad outcomes like stroke, heart attack, and other vascular disease, high blood pressure, things of that nature.
So if you had cataracts, you can pretty well look to having hidden problems with cardiovascular.
Right. And so what my mentor taught me, see, on the continuum, we have risks that beget changes in physiology, that beget changes in pathology that we ultimately call disease if it proliferates long enough. And the eye is the easiest place to look at pathology, which is closer to an end game of bad outcomes than, say, a bad risk or a high C reactive protein. And that's why it's such an important test. But we always have to back titrate to the labs to see what's going on, and then the risk to find out why. Because eye diseases just don't happen out of the blue. There's always a reason. I mean, people have to realize I'm diabetic. There's a reason. I have cancer. God loves me, doesn't hate me. So what's the reason behind that? We always have to be looking and peeling the onion back to find out why. And very much it always titrates back to food choices, stress, gut, uh, the ability of the gut to absorb nutrients really well. These play the biggest factors. These big three are the biggest factors in health.
You mentioned that it's not what we eat so much as what we absorb. Would you go into that a little bit,
Well,
please?
that's a good point, Wilda, because you can eat really nutritious food, but if your digestive system isn't working well, the carbs are easily absorbed, but the micronutrients embedded in your foods are very difficult to extract. It's not well published, but it's out there. And so, once again, disease, it completely relates to the mechanism that repair is the most important thing. And if you cannot absorb the micronutrients, your repair pathway is severely compromised. So now we all have damage and deterioration pathways. It's just the way it is. We live, right? We breathe oxygen, we move, all that stuff that, and we age. So that's where absorption is critically important. And a lot of people will marginalize their gut symptoms, say, oh, I just have diarrhea a little once in a while, or, I'm a little constipated, but I still go 3 times a week. No, these are signs. If you have any sign in the gut, your gut's in dysbiosis. And it's the single most important thing to work on, the functioning of your gut.
What is dysbiosis?
Dysbiosis really means that you have insufficient stomach acid, you have insufficient production of bile to absorb fats, digestive enzymes to help break down foods into their basic pieces parts. So like if you eat chicken, you're not a chicken. So you got to break that protein, chicken protein down to amino acids, then your body reassembles your proteins based on your genetic code. So we have to break these things down to rebuild. And you'd be shocked at how quickly tissue turns over, meaning how fast that cells are replaced everywhere in the body, including bone. Bone is like 5 years. You completely rebuild your bone. In your retina, it's 4 or 5 days. Red blood cells are replaced every 4 months completely. So
So if
it,
we don't have the nutrients to do these replacements, they're building inferior replacements. Is that correct?
inferior or just not building them fast enough. So, for example, I ask questions on my survey about, slow healing, easy bruising. And why would someone have that? And a lot of people have that is because they're not once if they bang something and bruise, it's damaged. You have to repair that. We're not a piece of plastic, and so there's a process there. And if you don't have those micronutrients that drive the enzymes, which are your body's carpenters, you're going to bruise easily and you're going to heal slowly.
Yeah, that's a lot of people are in that situation.
Uh-huh.
I mean, I see people that are apparently healthy, but my goodness, they just barely touch something and they bruise.
Uh-huh.
Yeah. So if we were, and we're about out of time in this segment, but if we were to look at our food, is would you say that that's a major cause of the problems in the gut?
Oh, it's it's in the upper 90s in terms of the problem, the lack of fiber, the lack of organisms, because we're sanitizing our food so much that we're not getting organisms from the food. We're not going outside enough, where we inhale dust particles from the soil, and that repopulates our microbiome. Any kind of medications that affect the gut microbiome, antibiotics, pesticides, all kinds of different things that can affect the quality, integrity, and diversity of our microbiome play a huge role in this. Dogs, for example, are considered to be, they help you live longer because they make you happy. They're little friends, but actually, you share some of the aspects of their microbiome, and that
Oh,
helps your diversity.
amazing. Well, it's time for us to take yet another station break. Dr. Lewis and I will be right back to continue our discussion, so you stay right there. This is Mission Evolution, www.missionevolution.org.
Hello, lamppost. What you knowin'? I come to watch your flowers growin'. Ain't you got
Let's take a closer look at cancer. This is Mission Evolution, missionevolution.org. With us exploring cancer as a chronic disease is Dr. Thomas J. Lewis. His website, healthrevivalpartners.com. Dr. Lewis, do tell, cancer is an infectious disease?
Oh, such a huge part of it. Even on the American Cancer Society website, they mention human papillomavirus and H. pylori, and they just say 10 to 20%. But if you look at Dana-Farber, not their oncologists, but their researchers, they say that the number one biomarker for cancer risk is the neutrophil to lymphocyte ratio. Let me just make it very simple. The neutrophil to lymphocyte ratio is a measure of the infectious burden in your body, not like a cold, flu, or COVID, but what we call subacute or chronic, that may make you feel a little tired or fatigued. And what Dana-Farber says is that if your neutrophil to lymphocyte ratio is high and goes up during cancer treatment, your likelihood of surviving is very low. But if you can lower that number, then your survival increases substantially. So that little piece of data from Dana-Farber, Ohio State University, and others just corroborate the fact that, and they're talking about all solid tumor type cancers. I haven't seen research on the blood cancers, but all solid tumor, including pancreatic cancer. If you can improve your infectious status, your subacute infectious status, your likelihood of surviving cancer increases dramatically. And so what I like to do with people is measure that, what I call the NLR, neutrophil to lymphocyte ratio, and provide interventions to optimize that. I like people to be at 1.3. I have people with cancer, they're at 12.
Ooh, my
And
goodness.
oh yeah, and that's a huge variation, but even 4 is a risk factor. So if we can improve that value through interventions, better food, exercise, the usual suspects, but also treatments, your likelihood of getting cancer goes down dramatically. Just think, if you have cancer and you're being treated with these checkpoint inhibitors, and improving the NLR significantly improves your survival compared to if the NLR goes up under the same treatment. Imagine what it can do for more healthy people that don't have cancer yet, at
So,
least a organized formal tumor.
so if you're looking at, infection, Right? That means there's probably hidden infection somewhere in the body. Like one of the things that I had someone on the show was talking about is like our teeth are really a hidden place where there's all sorts of things going on. In other words, there'd be a root canal and they got a cap on it, but there's still infection in there. But you don't have any symptoms. And so, with something like that, is that very common to have put a major stress on your disease state of your body?
Gwilda, that is absolutely the number one source of what I call Lyme syndrome. We all are familiar with Lyme disease, but Lyme disease is a disease of a spirochetal or spirochetal plural infections. And the mouth is also a source for spirochetal infections, denticola, Treponema denticola, and others. So they all can contribute to that pathology, and the connection between certain teeth with root canals and breast cancer is highly correlated. Chlamydia pneumoniae is an organism I study and measure pretty much in everyone, and it's titrated to lung cancer, other cancers, but also reactive arthritis, Alzheimer's, things of that nature. So, yeah, these things are ubiquitous. And at the end of the day, what they do is they create mild chronic inflammation. And I always tell people, rub the back of your hand with a pencil eraser and do it 24/7 for 2 months and tell me what the back of your hand looks like.
Right. Hmm.
And so it's not, the point is, it's not a big insult. It's just a little rubbing, a little pressure in the back of the hand, and initially it feels like nothing. But it will manifest into something very severe, and that's what happens with these organisms. But keep in mind, Gwilda, that when we die, we have to go to an undertaker. Why? Because we're going to start rotting. They're already there, and it's a delicate balance between our immune system, our repair pathways, and these organisms, some of which are beneficial, some of which are commensal, which another means we don't really see any kind of pathological issue with them. And then we have ones that are definitely pathological. And as we age, we have immunosenescence, so we become much more vulnerable. Immunosenescence means just loss in immune cell activity and integrity from things we've already talked about quite a bit. And so it's no surprise that we start getting a little sicker and a little more frail and feeble as we get older. But there are ways, you can ways around that. And healthy food is the first thing. And then we have a program where we don't just do vitamin supplements, but we do very high dose pulses of these vitamin supplements that augment immunity. And so that's one of our big strategies for people that are pre-disease or just have nagging complaints, but are not really um, you know on death's door, if you will.
So it's my understanding that taking supplements, I think this is one of the funniest things, is you take a drug, it's treating a symptom. If you take a supplement, it's not going to do a doggone thing if you're not deficient in that particular thing. If that's the case, how do you tell which ones to give people?
That's a really good question, and my people that I work with have angst over how many supplements they take. So I kind of have a flow of how we do this. Anything that supports gut health, I'm in favor of. Just don't worry about it, because that's the top of the. And we look at the foundation of health. That's like the foundation of a building, the gut. The second thing is we look at anything that is a known deficiency. So things like iodine, vitamin D, magnesium, even potassium. These are things that are very important to take. The third thing is anything that's in excess, and I look at infections as being often in excess, especially if that neutrophil to lymphocyte ratio is elevated. So we take supplements that will counteract these infectious species like vitamin D, vitamin A, oregano oil, immunoglobulins that are over the counter, things like that. And the fourth thing in the hierarchy of taking supplements is what is nagging you? What is your health complaint? And what are the biomarkers that support that? And what are the supplements that can improve those biomarkers? So that's where it becomes more personalized. But I think people have all these different things. They're taking NAC and glutathione boosters and all that. No, the number one thing you can do, if that's way downstream, is take things that improve the ability of your gut to absorb nutrients, and obviously eat good food along with that. That's the one two. That's where supplements really come in and augment basic health principles: eating good food, exercising, go out and getting sunshine, things of that nature.
Okay, so let's use an example. So say for example, um, say I have arthritis. Okay, just osteoarthritis from overuse. Okay, and it seems worse sometimes, better other times. But you're telling me that that's caused from something more dangerous, actually, in the long run. Where would you start looking with something like that?
So the first thing I do is make sure that their certain biomarkers are optimal. The main one I look at is called the erythrocyte sedimentation rate. That's one of the best markers you can use to tell if someone's absorbing well. It's not a perfect marker, but it's a really good marker. The next thing I want to look at is what's going on in the mouth, and because that plays a huge role. You know, when you go to a dentist, the hygienist does most of the work. The dentist sweeps in and looks at a two-dimensional X-ray. What are they looking for? Bone loss. See, these organisms, these spirochetes and other things, Fusonucleatum, bacterium, they live off of calcium, and the calcium is in your bone, and they can escape the oral cavity. You know, a red blood cell goes through your heart every minute. They can escape the oral cavity and find their way into other bony tissue. We shrink as we age. That's because a disc in your spine is like the Twinkie of a bone. And the organisms love going in there and grabbing the calcium, and it really creates a deficiency in structure, and you start shrinking a little bit. So these are the two big things I see in most people is something, especially as they age, something wrong with the mouth, whether they know it or not, because sometimes they don't, like you made the point, Gwilda, but I've had people with, you know, really bad infection under a crown, and the dentist said it's impinging on the sinus, and the person didn't even know that. So that's a place to look. And then, of course, making sure the gut's working well, so we're supporting our immunity and supporting our repair pathways. It's very basic stuff. There's no need for 68,000 diagnostic codes. There are some very simple things we keep doing over and over again to get people healthy.
If you're not symptomatic, how and people take one-dimensional X-rays, how are you going to find out if something's going on in the mouth?
So we do a swish and gargle oral DNA test, but I run a line blot, and that is a very imprecise tool. So we can say, oh, it's a horrible tool, but no, actually, oral pathogens show up when you're kind of like progressing towards more profound periodontal disease. They show up on the Lyme line blot, and they also show up on this biomarker I talked about before, the neutrophil to lymphocyte ratio. So I ask questions about the mouth. What kind of mouthwash? What kind of toothpaste? Do you have any receding gums? Do your gums bleed when you floss? These kinds of things tell me, or do you have crowns, root canals, whatever? Lost teeth, wisdom teeth pulled, and then you look at the biomarkers, and then if you want to go to the next level, you run an oral DNA test. And so the oral DNA looks at what's going on directly in the mouth, and things like the white blood cell counts, neutrophil to lymphocyte ratio, and the Lyme line blot tell me, has it escaped and it is now systemic? Is it a perfect correlation? No, but when we treat people to reduce those burdens, they usually get better. And the number one thing that gets better is energy. The number two, the thing that gets better is chronic pain. And the number three is poor sleep.
Oh, interesting. Poor sleep.
Yes. I mean, the sleep is brain inflammation. I mean, that's not the entire story, but think about how close the mouth is to the brain. And, you know, these organisms can get right in the CNS of a root canal. We've lost a nerve, we've lost a blood supply, but they can still get in because there's no immune defense there anymore.
Gotcha. Well, it's that magic time. We are going to have to take another station identifier. Please stay with us as Dr. Lewis and I continue to explore what we may be missing in our approaches to healthcare. This is Mission Evolution, missionevolution.org.
Me
Are you setting yourself up for chronic disease? This is Mission Evolution, evolution.org. We're continuing our discussion with Dr. Thomas J. Lewis. His website, healthrevivalpartners.com. Dr. Lewis, what would you say that the average person is doing unwittingly that's setting them up for chronic disease?
Oh, that's such a great question. We have control over our health, even though the authorities are working against it with this low fat paradigm and, the funding. The New York Times had an article on how the USDA funds junk food. So it makes it very difficult for low income people to be healthy because the unhealthy choices, the soy products, the high fructose corn syrup products, the wheat products are very inexpensive compared to healthy food. No one's subsidizing the growth of Brussels sprouts, for example. But a lot of people go out to dinner, and rather than choosing a locally owned restaurant, they'll go to a chain, and the prices are pretty good. But the thing is, these corporate food, a lot of people own stock in mutual funds with these uh, you know large food companies, large food distribution, and it turns out there's only a couple in the entire country that are responsible for the distribution of all the corporate food. And if you have a mutual fund, you want it to grow, right? And
All
so there
right.
has to be a better profit margin. And so these corporate foods, Texas Roadhouse, Applebee's, all these places, the food is of the lowest quality they can get away with. And so, the old expression of think globally and act locally, but shop locally, uh, go to places that are locally owned. It keeps your economy good. But the other thing you need to do is you go to farmers markets and you make your own food. One of the songs Simon and Garfunkel was, about taking time. We got to spend more time on our health. We got to cook our own food, and this is the most basic thing you can do. And in the long run, you'll improve your microbiome by being outside. You'll improve your vitamin D status by being outside, and you'll have your own food, and you'll have a lot of pride behind that. And so I think that's a really important first step to taking control.
It is huge, isn't it? And you think of what our children are growing up on, it causes one to cringe. How much do you think how important is it to be going for the organic? I mean, I know that it's well more expensive to buy organic produce, say for instance, and this and that. But how important is
So
that?
that's another great question, Gwilda. I think there are three stages. Number one, just get away from packaged food, things with more than one ingredient on the label. Shop the outside of your local grocery store. That is a huge leap forward in terms of nutrition.
By
But
outside, you mean the outside aisles where you
the
have
outside
vegetables and
aisles
fresh
where,
stuff. Gotcha.
yeah, exactly. So
Hmm.
nothing in a box, only a single ingredient, the whole food, and nothing but the food, if you will. The problem with that is that it's still grown on large commercial uh, farms that have been subsidized by the government. And Dr. Maynard Murray did studies on food nutrition in the 1950s and published it in the early 1960s, and showed even back then that plants were quite deficient in some of the micronutrients, which then meant they were deficient in vitamins. And he further showed that animals that ate these foods were deficient in vitamins. The eggs, the choline content, and the yolk, and all these other things were very deficient. When he compared it to land that he worked on to really increase the nutrient levels of the soil, letting them lay fallow for a year or two so the bacteria can break down the soils and replenish some of the micronutrients like molybdenum, cobalt, selenium, things of that nature. So I think that's where the organic farms have some advantage, in that if they're doing proper crop rotation and allowing for field laying fallow, which is hard to do when you're trying to scrape by in farming. It's not an easy discipline, but you're gonna have much more nutritious. It's not about calories. Calories. When you look at these kids that are obese, there's no calorie issue there. That is all a micronutrient deficiency. and a concept I call hidden hunger. It's well published, but just not well read. That you can have hunger if you're magnesium deficient. So, for example, a craving for chocolate might be a magnesium deficiency. But look at these obese kids and kids with diabetes now is really they just micro. It's not an excess of sugar. It's a deficiency of nutrients, which continues to drive the hunger in the
Mm,
face of an exorbitant amount of calories.
basically starving amongst plenty.
Mm-hmm.
So, let's talk a little bit about the chemicals that we find in our food. Um, don't some of the chemicals that are commonly sprayed, or the artificial fertilizers and the pesticides, do those actually block your ability to absorb, kind of like replace what you really need?
It's a very interesting concept. I'm sure they may, but the number one thing we see is a lot of these chemicals are endocrine disruptors.
Okay.
And when I look at people's labs, it's shocking. I have a lot of healthy people, well educated in health, that come to me, and I run labs on them, and their thyroid hormones are in the lower quarter of normal. Their
Mhm.
estrogen, testosterone is low. So, and that's why we're having all this potential gender confusion, because we really, our hormonal balance is really affected by these things. The plasticizers, the pesticides, the glyphosate, that, besides having toxicity towards cells, they're affecting the liver's ability to produce different substances. So that's the major problem that we're having with these
With the
substances.
chemicals.
Yep.
It's that time in the show when I get to ask you, what's your mission?
So that's I appreciate that question. So my mission is to run the least expensive population-based health program there is. We believe that for under well under $1,000, we can solve 80% of the problems in 80% of the people, especially if we get to work with them early on. And so I'm working with 4 different teams that are trying to embed my basic program into programs that are actually have an insurance backing, mainly a self-insurance backing under a new model. So this is not something that's happening tomorrow. I've been working at it for 20 years, but we're moving up the curve fairly rapidly right now, and I think we may be in population health. So I don't consider myself a functional doc that's going to carve out, you spend 5 grand or more to really try to figure out and optimize one individual's health. That's not going to move the needle. We need to really develop a better, what I call foundational medicine, which is a parallel to the existing system that totally focuses on chronic, but does it in a very efficient way. We call it the hierarchy of health. And so that's really where I'm heading at this point. And I still work with people individually, and I learn so much by working with people at the same time, and it helps improve our overall program that we want to administer. But my main goal is to be able to work with large populations.
That's so needed. Thank you so much for going out there and doing that. I mean, it's can't be an easy thing because you're bucking the system, sir. In case you hadn't noticed, right?
So, Gwilda, what we are doing right now is that we have a number of groups that have figured out better ways, better, faster, cheaper ways to administer health plans to groups, and they're embedding our program. It's not my program, it's our program. I have many doctors that contribute to it. It's sort of a Trojan horse, because at the end of the day, it looks like a risk assessment and a set of labs and a set of interventions. But so we're doing it in a way that people just it'll just help people and not look like we're saying, oh, we need to completely strip down this old system and build a new one. No, we have to reach across the aisle and participate side by side with these folks in what I think is a fairly clever way.
Well, there's nothing wrong with the doctors. They're a bunch of really well-meaning, beloved people that are crippled by the system, as far as I can see.
The best word I've heard for that is crippled. They are just crippled, and it puts them in a state of fear for because if you lose your license, what are you going to do? become a plumber. I mean, you put 20 years into education and you've worked at this thing, and believe me, you're being scrutinized from on every encounter to make sure you're doing what the standard of care wants you to do. So they really are crippled, hands are
And,
tied,
and
and
that'd be lovely if the standard of care wasn't so broken itself.
exactly, but we have the tail wagging the dog. I don't think we need to go into the conspiracy stuff, but what I really reiterate what I said earlier is that at the end of the day, the options out there, they may be more expensive in cases, but we're not taking enough responsibility. There's a lot of blame and, oh, woe is me. Take more time to prepare your food, to buy good food, to choose restaurants that aren't of huge profit centers that you're making money off of because of your stock market portfolio and things like that, and realize you don't want the cheapest option. You want the best option for your health. I mean, you only
Yeah,
have
you
one.
can you can invest on one side or the other, can't you? So
Exactly.
so it is that time actually. We're out of time in the entire show. I can't thank you enough for all that you're doing in the world and for coming on the show.
Appreciate you having me on, Gwilda.
My pleasure. Our guest this hour has been Dr. Thomas J. Lewis. Dr. Lewis is a leading authority in the mechanisms of chronic disease and the author of numerous books, including Cancer is an Infectious Disease. To find out more about Dr. Lewis, where you can find his books and all he has to offer, visit his website, healthrevivalpartners.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit us at www.missionevolution.org.
It's the right time of the night.